Sashikala Ashok is happy to be back in the driving seat after months of being dependent on others. As she drives to her friend's place to meet and spend time with her, Sashikala senses an enormous amount of freedom in her life today. But it was not so long ago when her life had started moving in reverse gear. Shashikala was diagnosed with fibroids in her uterus. A mother of a teenage daughter and a homemaker, 45-year-old Shashikala was in a state of shock when she first learnt about her health condition.
All I went was to treat myself for a urinary tract infection. When I was told I have fibroid, which is complete news to me, and actually I argued with her also. Then if you say that I have a problem like a fibroid, then why my periods are regular? She said, no, that is not the thing. Sometimes always also these things happen. You cannot still say that just because you had your periods on time and your bleeding stopped right on fifth day does not mean. Actually, she said that's the time she told me that you would have had lot of clots, not normal bleeding, lot of clots, which a lot of people think it's normal. That is the thing which says that you're not normal.
Fibroids are lumpy growths in the wall of the uterus because of the muscle tissue which is overgrown. These are usually benign tumors that can be either deeply seated within the muscle layer or can be encroaching into the cavity of the uterus.
If you take an average, a normal menstrual cycle lasts between 2 to 7 days with an average flow of 80 to 100 ml per day. If there are clots during the menstrual period, if there is flooding, if the woman needs to have double protection, and if they have nighttime flooding, if they have fainting episodes during their periods, or they are rendered anemic with the loss of hemoglobin because of the heavy flow during periods, or experience heavy flow associated with severe pain during periods, this could be suggestive of presence of fibroids in the womb of the woman. Certain fibroids grow to an enormous size, causing significant increase in the size of the uterus, mimicking that of a pregnant size, right up to 32, 34 week size uterus.
Although Shashikala wasn't planning a second child, but she had a deep resolve to protect her uterus if it was clinically feasible.
Probably you're compensating that because you're still young.
This led her to consult many doctors until she found a urogynecologist who was in favor of performing a surgical procedure called myomectomy.
She saw the scan report and she said everything what you're saying is 100% right. Your uterus is actually fine. Your ovaries are fine. In your case, you can definitely retain your uterus because this is in the outer walls of the uterus. The fibroid lies in the outer walls of the uterus. So fibroid alone can be removed. This was the first thing she said. She is the first person I met who said my uterus can be preserved. It was extremely, kind of moment of joy for me.
Her hemoglobin was only 5 or 6 grams, which was a very severe degree of anemia, but it was chronic in nature because she had not become symptomatic in terms of being breathless or other features of severe anemia, but she definitely complained of severe exhaustion even during normal household chores. On examination, she had a huge fibroid about 8-9 centimeters in the back wall of the uterus, mainly confined to the muscle body of the uterus and in the wall of the uterus, not jutting into the cavity. I corrected her anemia by giving her IV injections of iron infusion, and with 3 or 4 her hemoglobin came up to a good reasonable amount of 11 grams, which was good enough to get on with the surgery. Myomectomy is comprising of 2 halves of the single word. Myoma meaning fibroid. Anything which is ectomy means removal. So in simple terms, removal of the fibroid alone is called myomectomy. So the fibroid could be in the outer wall of the uterus, within the wall of the uterus, or inside the cavity. For her, it was single fibroid, the blood supply was mapped, it was much more on the muscle wall, emanating up to the surface, and it was feasible to do. The sheer size of the fibroid and the access to this particular back wall of the uterus was a much more a challenge if we were to do a laparoscopy or an open surgery, which is why the robotic approach was preferred.
Traversing along the ups and downs in Shashikala's life is her husband Ashok. It was his immense support that made her take the decision of surgery sooner rather than later.
I think all the women go through when you discuss about a surgery, especially a vital surgery like this, that insecurity if the husband supports, half the insecurity is gone. You know you can face it. First of all, it's a big confidence, and he made me feel that, have that confidence. He was the reason I went ahead with the surgery, because he was completely there supporting me completely.
Shashikala underwent a robotic myomectomy in April 2015. The surgery was successful and the entire fibroid was shelled out effectively.
No remaining fibroids were left. She didn't drop her hemoglobin that much, and she was discharged the very next day. Her recovery was pretty quick. She was even able to attend a social function within a week of surgery. On follow-up and a repeat ultrasound, her hemoglobin remained 12 grams, which she has never had before the surgery, which I had already explained she had in the range of 5 or 6, and her repeat ultrasound did not reveal any new fibroids or remaining fibroids.
And raise your hands up. Now looking to the left hand, same procedures, exhale, go down.
She made a speedy recovery. Within 4 weeks, she was practicing yoga with her personal trainer.
Breathing is very important. No holding the breaths.
It helped her re-strengthen the pelvic floor muscles, which is critical after the procedure of myomectomy.
When the problem is very small, it's easy to treat. But if you develop into a big thing, you can't even treat it.
The surgery has been a life-changing experience in more ways than one. It has brought Shashikala closer to her teenage daughter.
Actually, it might be a very small, trivial problem also.
She believes that educating her daughter about women's health concerns will only empower her to make better health decisions in the future.
As a mother, when you've gone through a few things and when you talk to your children, this is how life is, this is wrong, if this happens, we have to consult a doctor. Why is it important to maintain personal hygiene? And all those things, when you talk, they know that it is for sure is going to help them.
Shashikala's menstrual cycle is back on track, enabling her to lead a healthy and a stress-free life.
Hello everybody. I'm here to give you a quick update on Mrs. Shashikala and Mrs. Hema. In this episode, we saw two middle-aged women going through complex health issues. Mrs. Shashikala, who underwent a robotic myomectomy, was discharged after 24 hours and has made a smooth recovery. She has resumed living a normal yet healthier life. The second patient, Mrs. Hema, who underwent incontinence surgery, was discharged the same day. After recent review, she remains active with no other concerns. Folks, it is always in your best interest to take care of your health. Your life is truly priceless. Treat it like the gift it truly is. Till we meet again next week in Let's Talk Health. Goodbye for now.